Do you wake up every morning wondering if this is the day your knees will finally give out? Are you over 50 and dreading the stairs, terrified that your independence is shrinking with every painful step? If you are just masking that pain with painkillers and relying on the next expensive temporary injection, you are making a fatal mistake. You are treating your joints. You are just silencing the alarm system while your house burns down. I'm Dr. Alex, and today I am going to give you the honest, uncomfortable medical truth about joint degeneration. I'm going to tell you exactly how you can save your knees and avoid a future of disability and surgery without wasting thousands on quick fix injections. We are going to focus on 3 specific, non-negotiable habits that modern medicine knows can halt degeneration and even promote repair. But here's the catch. They require discipline, and the medical industry doesn't make billions off them, so they rarely talk about them. By the end of this video, you will have a complete medical protocol for your knees. You will understand exactly why your joints are failing and exactly what you must do to save them. Let's start with the hard part. The joint pain industry is massive. Their business model is built on repeat customers. Think about it. If they cured you, you wouldn't come back. They sell you injections, cortisone, hyaluronic acid. Don't get me wrong. As a doctor, I know these have their place. They can reduce acute inflammation. They can buy time, but they are not a cure. And if you are relying on them year after year, you need to hear this. First, many of these are expensive band-aids. They reduce the pain, which tricks you into loading the joint exactly when it should be resting. The result? Accelerated structural damage. Second, and more importantly, they change nothing about the mechanics that are killing your joint in the first place. Imagine your car's wheels are out of alignment and they are tearing the rubber off the tires. Do you fix the car by giving it a nice wax and polished hubcaps? No, you align the wheels. Your knee joint is failing because of mechanics, not because it has a lack of cortisone deficiency. Your cartilage doesn't degenerate because it's aging. It degenerates because the load exceeds its capacity. If you don't change the load, the mechanics and the environment, the strongest injection in the world will fail you. You are just lighting money on fire. Let me tell you about Sarah, a 54-year-old patient I had a few years ago. She had moderate knee pain, grade 2 arthritis, and like most people, wanted the fastest solution. Her previous doctor gave her cortisone shots, once, then twice a year. For 5 years, it worked. The pain went away. Sarah felt great. She didn't change her diet, she didn't lose the 30 pounds she needed to, and she didn't do the physical therapy. Why should she? The pain was gone. Then one day, Sarah came to me. The injections had stopped working. The pain was excruciating. We took new x-rays. Sarah didn't have grade 2 arthritis anymore. She had grade 4, full bone-on-bone joint destruction. Sarah had used the absence of pain to completely destroy her knee joint. The cortisone hadn't stopped the arthritis. It had just masked the warnings, while the joint was ground into dust. At 59, her only remaining option was a total knee replacement, which she wasn't physically healthy enough to undergo easily. Passive treatment killed Sarah's joint. Today, we are here to talk about active treatment. This brings us to habit number 1, the most critical and the one my patients hate the most, structural decompression, and that means weight management. We are going to do some simple medical math. For every pound, 0.45 kilograms of weight on your body, your knees take an average of 4 pounds, 1.8 kilograms of pressure per step. 6 pounds, 2.7 kilograms when you walk upstairs. If you are just 10 pounds, 4.5 kilograms overweight, you are adding an extra 40 pounds, 18 kilograms of grinding force to your knee every single step you take. This is pure physics. You cannot regenerate cartilage that is being crushed under a 400 psi load every time you walk to the kitchen. It's biologically impossible. Cartilage needs nutrients, and nutrients are delivered by joint fluid only when the load is reduced. The mechanics must change before the biology can repair. If you are not working aggressively to lose excess weight, you are actively choosing knee degeneration. You are prioritizing your plate over your ability to walk in 5 years. That is the honest truth. Habit number 1 is a strict anti-inflammatory caloric deficit, combined with low-impact movement, specifically designed to lose fat. This isn't about vanity. This is about mechanical decompression of your skeleton. Now, we get to habit number 2, building your muscle shield. Most of my patients with bad knees have excellent quadriceps and hamstring muscles for a 15-year-old. They have forgotten that after 40, you are fighting sarcopenia, muscle loss, every day. Your muscles do 2 critical things for your knee. They move the joint, which is obvious. They stabilize the joint and absorb the shock before it hits the cartilage. When your thigh muscles are weak, your knee joint rattles. The femur slides around on the tibia, creating shearing forces that tear the cartilage apart like a saw. Weak muscles mean unstable mechanics, which equals joint destruction. You must develop a specific, disciplined strength program. We aren't training for the Olympics. We are training for stability. This means low-impact, muscle-isolating exercises, leg extensions, leg curls, and unloaded swimming or cycling. You are not strengthening by just walking on painful arthritic knees. You are grinding. You must build the muscles around the joint to create an internal suspension system. When your quads absorb the shock, your cartilage can rest and repair. This habit is not optional. Muscle shielding is the difference between a future in a wheelchair and the future walking your grandchildren. The mechanics are fixed. Now we need habit number 3, nutritional recovery and the elimination of inflammatory junk. This is where my medical Rosnos, the debunking, needs to hit your kitchen. If you are over 50 and have knee pain, you are a machine that is constantly running too hot. It has systemic inflammation. Arthritis is an inflammatory condition. Your immune system is attacking the cartilage, and if you are fueling that inflammation with processed sugar, fried foods, seed oils, and simple carbohydrates, you are giving the arthritis the tools it needs to finish you off. Habit number 3 is a strict dietary shift to an anti-inflammatory, nutrient-dense medical protocol. This is about recovery, not dieting. First, eliminate the triggers. Second, provide the building blocks. Your joint tissue needs specific amino acids to rebuild its collagen matrix. This means increase high-quality protein, collagen peptides, bone broth. It means omega-3 fatty acids to combat the inflammation internally. It means antioxidant-rich vegetables to fight the damage. You are not treating arthritis. You are treating a whole person. Nutrition is your internal medicine. It dictates how well your body can utilize the mechanical advantages you gave it with habits number 1 and 2. Now, let's look at what works. Let me introduce you to Michael, a 58-year-old man who was facing the same problem as Sarah. He had grade 3 arthritis and severe pain. He had tried injections, but he realized they were temporary. Michael came to me for a different path. He didn't want the quick fix. He wanted his life back. He executed habits 1, 2, and 3 simultaneously. It was hard. For 6 months, he lived a life of discipline. He lost 25 pounds, which medically decompressed his joints by over 100 pounds of pressure per step. He built specific leg strength, and he completely changed his diet. 6 months later, we took new x-rays. While Michael's cartilage didn't regenerate magically back to the knee of a 20-year-old, the x-ray was stable. The cartilage had stabilized. The joint space was preserved. More importantly, Michael's pain was gone. His function was 100%. He was hiking, something he hadn't done in a decade. This is the power of systemic, doctor-led active treatment. You don't have to choose a future of disability. These 3 habits, structural decompression, Muscle shielding and nutritional recovery are not suggestions. For your knees, they are life and death. Passive treatment with injections is easy, but it is dangerous if you rely on it. You are better than that. Your body deserves better than that. Here is my direct order to you. If you have pain, do not diagnose it yourself. Go to your own doctor immediately. Demand a comprehensive physical examination and proper imaging, X-rays and/or MRI. Take the 3 habits we just discussed and ask your doctor how you can implement them into your specific treatment plan. Ask for a referral to a professional physical therapist. Do not just ask for the next injection. It is your health, your walk, and your future. If this video opened your eyes and gave you a real plan, do me a favor that costs you nothing and could help millions. Hit the like button. This helps this real medical information reach someone else over 50 who is giving up hope. Subscribe to this channel. We don't do fake cures here. We do real medical science delivered with direct truth. Comment below. Tell me about your knees. What injections have failed you? What part of this 3-habit plan are you starting today? I read the comments. Thank you for watching. It's a privilege to be part of your health journey. Be disciplined, listen to your body, and always consult your physician.